What's going on, world? How are y'all? How are y'all? Well, y'all already know who I am. My name's Kevin. How y'all doing? Hey, so today we are going to be doing NCLEX questions. We are going to be doing NCLEX questions today. So when you guys get in here, I want to know who you are, where you're from, where you're at in your nursing journey. We're going to be doing NCLEX questions. So big shout out to all of y'all that decided to come hang out. Also, big shout out to all of y'all that decided to come to the nursing summit yesterday that was put on by Picmonic and True Learn. Had a good time there, answered a couple of questions. I actually am going to put that up on my YouTube channel. That way, if you want to see it, you guys can go out there. You guys can go out there and look at it. But it was definitely a good time. It was definitely a good time. Went over some stuff that had to do with the NCLEX itself, the updates, how many questions, so on and so forth. So, it was a good time. So make sure you guys go over there and check that out. Hey, but if you guys are new here, I want to know who you are, where you're from, where you're at in your nursing journey. Y'all ready to do some NCLEX questions? Make sure y'all smash that like button, y'all share, y'all follow me, all that good stuff. Because the more likes, shares, and follows, the more that the algorithm of TikTok decides it wants to like me and kind of push it out to people that need it. We're already in October, y'all. Already October. So my nursing students, you guys are almost halfway through the semester. And then before you know it, semester's going to be done. People are going to be graduating, all that stuff. Megan, Omaha, Nebraska. Okay, 32 MedSurg 2. All right, shout out to you, Meg. Shout out to you, MedSurg 2. Second half of the book. One recommendation I would recommend for you to do is if you're not in a small group, I would recommend being in a small group. Kind of 10x your thought process and think of the teamwork aspect if you've never worked as a nurse. So think about it like that. 25%, you do 25%, other three people do 25%, bring it together. So you do 25% of work, but you reap 100% of the benefits, and that goes for everybody that's part of that group too. Everybody pulling their equal weight. Not like how it is when I tell you to do a group project, when you're in school and you dread it. You know what I'm saying? So, but yeah, you're welcome. Shout out to all 13 of y'all up in here rocking with me. Make sure you guys share. Make sure you guys smash that like button. Hey, once we get a good amount of people up in here, I've only been live for 2 minutes, but once we get a good amount of people up in here, I will turn this camera around away from this disgusting, hideous face that you see. And we will throw up the questions. But if you're new here, hey, let me know who you are, where you're from, where you're at in your nursing journey, all that good stuff. All right. Hannah from Alabama, 24 and funds. Okay, so you just started school. All right. Shout out to you, Hannah. Shout out to you. And you from Alabama? Please tell me you got a foldable chair in your arsenal, just to make sure, because I don't need folks testing you out there, because, people be acting crazy. You know what I'm saying? So, yeah, got 26 people that are rolling up in here. All right. 30. All right. Shout out to all y'all. Make sure you guys like, share, smash. We're going to be going over NCLEX questions today. Hey, I'm kind of funny, sometimes. What's up, user 57? I don't know your name. I don't know your name because that's what it is, so I'm just going to call you user 57. Kind of like passenger 57. Am I showing my age right now? I guess it don't even matter. But yeah, we're going to be doing these questions. Make sure you guys participate, right? I talk a lot because I am actually an educator, so this is the biggest type of reaction that I can get as I talk to you guys. D, okay, shout out to you, D. How are you? Welcome. I appreciate you being here. We got 86 folks up in here, 99 folks up in here. All right, cool. Hey, if you guys are just joining, make sure you guys smash the like button. My name is Kevin. I go by the Boot Nurse on all social media platforms. Make sure you guys go over there and check them out. YouTube, Instagram, X, Thread, whatever. You do you. Do you educate any lawyers? Maybe I should. I should consult some lawyers, huh? You take your NCLEX tomorrow, I'm going to need for you to get off this live. If you take your NCLEX tomorrow, get off this live. Go away. Go home. And, well, you know what I mean. Because, hey, if you don't know it by now, you don't know it at all. So you need to be taking this time to really just trying to relax. I know that's a lot, said than done, but I need for you to be relaxing right now. Relax that mind as much as possible. So L, I'm going to need for you to take this L and go away. And I mean that in the most respectful way possible. But, hey, we got 190 plus people up in here. Hey, you already know what the deal is. I'm about to turn this camera around. We're going to get started with these questions. I want participation. I want the likes. I want the follows. And I want the shares. All right, give me 1 second. Here we go. I'm pretty sure everybody can see that. Hey, so welcome. We're doing NCLEX style. We're NCLEX questions. Make sure you guys participate. I'm kind of funny, but whatever. The more likes, the more questions you guys got. I got a good amount today. Give me all them likes. Don't troll my chat. You troll my chat, I'm gonna ban you. Don't be rude. Don't be rude to others. Make sure you guys participate and talk to one another down in the chat as well. Watch your lives often. Pass my NCLEX. You help me so much. Just coming to say thanks. Jen, I appreciate you. Hey, all 200 y'all, give Jen her love, give her her flowers, let her know how much y'all think that she's awesome. But hey, Jen, welcome to the greatest shit show ever on earth, which is being a nurse. And I'm just saying that with sarcasm, kind of, sort of, not really, but welcome. Congratulations on, you passing. I know it's hard. It's a very tough exam, and I'm glad that you passed. And I know you're going to go out there and do great things. So we appreciate you. I appreciate you coming to the live. Hey, if you decide that you want to send me like an email and say like, hey, your lives helped me out so much, like it was great. I'll never object to that. All right. But congratulations to you. I don't gatekeep. I got these questions off nurselabs.com. So if you guys want to go over there and check that out, you guys can. 7-day NCLEX course is still in this pre-launch phase. We had a price increase because we have enough content in there. So, and we've got about a good 10 to 12 pieces of content and some other good stuff going in there this week as well. So make sure you guys go over there and check that out. Also, if you need one-on-one or would like one-on-one coaching, you guys can go check that out over at thebootnurse.com. All right, now here we go. Let me make sure. Can everybody see that? I think everybody can see that. Could you do a session on cardiac? I like watching your lives. Yeah, I think we could do that. We can find some stuff. Uro's pretty good as well. All right, here we go. Here we go, y'all. Here we go. A patient with Parkinson's disease has a nursing diagnosis of impaired physical mobility related to neuromuscular impairment. You observe a nursing assistant performing all of these actions. For which action must you intervene? So this question is saying to you, what is the UAP or the nursing assistant doing wrong? You can't see the whole question? Hold on. Is that better? Can you see it right there? Let me know if that's better. I've never taken a nursing class, but I passed the NCLEX. That checks what? That checks to see if you're ready. Oh, okay. Cool. All right, I think, okay, cool. Everybody can see it. All right, so the nursing assistant assists the patient to ambulate to the bed, to the bathroom and back to the bed. The nursing assistant reminds the patient not to look at his feet when he is walking. The NA performs a patient's complete bath and oral care, or they set up the patient's tray and encourage the patient to feed himself. We got A, he needs help feeding because of tremors. Okay. I'm gonna give you guys, I got a timer going on over here too because some people don't like it because when I sit here and talk to y'all too much. So with that being said, I'll give you guys about another 20 seconds to answer this question. So shout out to all 200 and almost 300 y'all up in here. Make sure you guys like, share, smash that like button. Those honey Pastor NCLEX, hey, shout out to you, honey, shout out to you. Everybody give honey her flowers. You already know the deal. Welcome to the shit show. Welcome to the greatest occupation of all time, of nursing. Welcome to it. Congratulations to you. Everybody show her her flowers, show her some love, let her know, hey, we appreciate you for being here. Now you have to go out there and really appreciate that life of, being the number one loved occupation in the United States of America. So here's you guys' answer. Your answer is C, perform the patient's complete bed bath care. The nursing assistant should assist the patient with morning care as needed, but the goal is to keep the patient the goal is to keep this patient as independent and mobile as possible. So shout out to y'all who got the answer right. Hey, this is part of management of care. Remember, management of care or coordinated care, if you're an LPN, this makes up the largest section on the NCLEX. You guys will hear me say that. Hey, honey, here's another thing to you, is that hey, if my lives have helped you out, hey, you can send me an email, just being like, hey, or, you can go over to my TikTok or my Instagram, leave a comment, whatever, tell me, the lives help, whatever. That helps me out. I helped you out. Cool. I love it. Here we go. But, hey, congratulations to you again, all right? Oh, good. That's why I appreciate you. Now, you see, your name is Honey, and I want to sing a Mariah Carey song, but, I ain't got the voice for that. So here we go. Question number 2. The nurse is preparing to discharge a patient with chronic back pain, chronic low back pain. The statement by the patient indicates that additional teaching is necessary. So what did my patient say wrong? And these are both for RN and LPN. It doesn't matter what the exam is. What was stated incorrect that I as the nurse need to correct? I will avoid exercise because the pain gets worse. I will use heat or ice to help control the pain. I will not wear high heel shoes at home or at work. I will purchase a firm mattress to replace my old one. All right, I'll give you guys another 20 seconds. We'll say 25 seconds right now. We got A, okay. Got A. Leslie says B. Shout out to all 200 plus of y'all up in here. I want to know who you are, where you're at in your nursing journey. Make sure you guys smash that like button. Hey, I'm just saying, last time I had like 30,000 likes. We got to get there. We got to get there. A, B, okay. All right. A, oh, A with the exclamation mark, okay. Smiley face, appreciate the follow. Allie from Indiana and LPN, shout out to you, Allie. All right, here we go, y'all, here we go. Here's our answer. Legacy, appreciate the follow, thank you. Been a nurse for 5 years, haha, this is such a throwback. Hey, come in and participate. Hey, make sure you bring that throwback jersey with you, because that's how we do. All right, here we go, here's our answer in 3, 2, and the answer is A. I will avoid exercise because the pain gets worse. Exercises are used to strengthen the back, relieve pressure on compressed nerves, and protect the back from re-injury. During exercises to strengthen the lower back, doing exercises to strengthen the lower back can help alleviate and prevent lower back pain. It can also strengthen the core, legs, and arm muscles. According to researchers, exercise also increases blood flow to the lower back, which may reduce stiffness and speed up the healing process. Okay. Somebody said they failed their NCLEX. Failed NCLEX once, scared to retake it, going to do Remar nursing, then try again, been out of school for a while, I'm assuming. Okay, shout out to Remar. She has a pretty good program out there. So also, I have my own program out there as well. You can check, hey, anybody that's looking for an NCLEX program, but I'm in the pre-launch phase, so anybody that's looking for one, ready to grow, it's out there. It's in the link tree as well. So here we go. Question number 3. Is it K, baby? Oh, you said you've been out of school for 1 year. Oh, okay, I got you. Now you just got to put yourself on a plan, all right? Don't be scared to take it. Don't be scared to take that exam. That exam has nothing to do with you. It has everything to do with basic nurse safety, okay? You just need to figure out what it's asking you. All right, here we go. Question number 3. A patient with a spinal cord injury complains about a severe throbbing headache that suddenly started a short time ago. Assessment of the patient reveals an increased blood pressure of 168/94 and a decreased heart rate of 48, diaphoresis, and flushing of the face and neck. What action should you take first? So this is who do I see first? Oh, I'm sorry, not who do I see. This is a priority question. Like, what is the very first thing that I should do? Do I want to administer ordered Tylenol? Do I want to check Foley for kinks or obstruction? Adjust the temperature in the patient's room, or notify the provider of change in status? Somebody says B. Okay. All right, got D. So we got B, got D, B, D. Chrissy says D. Okay, Whitney says D. Hannah, okay. Shout out to y'all. Hey, if you guys are new here, appreciate you guys being here. We're doing NCLEX questions. Make sure you guys smash that like button. Make sure you guys like, share, follow, all that good jazz. Hey, I'm just saying, I had 50,000 likes. Last week. Make it happen. Autonomic dysreflexia. Look at that. Oh, okay. All right. Let's see, right? What should you do first? Remember, it's on a systematic. It's numerical. So what is the first thing, the second thing, the third thing? That's what I do. All right, here we go. Here's our answer in 3, 2, and the answer is check the Foley, right? For kinks and obstruction. These signs and symptoms are characteristics of autonomic dysreflexia. Shout out to y'all who got that, right? A neurological emergency that must be promptly treated to prevent a hypertensive stroke. The cause of this syndrome is noxious stimuli, most often a distended bladder or constipation. So checking for poor catheter drainage, bladder distension, or fecal impaction is the first action that should be taken, okay? So shout out to y'all. Shout out to everybody. Like, looks like autonomic. That's what it was. So here we go. Question number 4. Shout out to all y'all. Which patient should you, as charge nurse, assign to a new grad RN who is orienting to the neurologic unit? So think about it on a grand scale. Paint the picture. You're the charge nurse, and you need to give some baby nurse an assignment. Who are you going to give them to? Remember, they just came out of school, so they know the basics of the basics. So what is it? Is it A, a 28-year-old newly admitted patient with a spinal cord injury, a 67-year-old with a stroke 3 days ago and left-sided weakness, an 85-year-old dementia patient to be transferred to a long-term care facility, or a 54-year-old with Parkinson's who needs assistance with bathing? All right. Nikita says D. Okay. All right. Did you change your answer? Is that why you're laughing? Yeah, you said F. That's what it was. Okay. Most stable patient who is less likely to change conditions. Shout out to you, Brooke. Okay, all right. All right, I'll give you guys another 20 seconds. We got B, we got D, C, because they're stable. So think about those key words that stick out in your answers, like the word newly or 3 days ago, right? Or they're being transferred, right? Or think about this, needs assistance with bathing. Like, who can do that, right? C turned into an empty what? C turns into an empty bed. Stop. All right, here we go. Answer in 3, 2. And the answer is B. A 67-year-old patient with stroke 3 days ago with left-sided weakness. The new grad RN who is orienting to the unit should be assigned stable, non-complex patients, such as the patient with a stroke. So the key thing about that was what? What was the key thing? What was the key portion of that answer? Right? The key portion of that answer was 3 days ago. So are they acute? No, they're not acute. They're stable at this point. Well, I mean, but they had a stroke, so they're gonna have those, residual signs and symptoms of what a stroke would do. So they have left-sided weakness, right? There you go, and they're stable. Now, if it would have been like, hey, if I just came in here, 2 hours ago from a stroke, might not want to do that, right? Don't want to do that. Don't want to do that to a new nurse, right? Stable, not being transferred, not an assignment for 8. There you go, Jordan. All right, here we go. Question number 5. A patient with a spinal cord injury at levels C, 3, and 4 are being cared for in the emergency department. What is the priority assessment? Determine the level at which the patient has intact sensation. Assess the level at which the patient has retained mobility. Check blood pressure and pulse for signs of spinal shock. Or monitor respiratory effort and O2 saturation levels. All right, protect that airway. Okay, all right. Hey, GCS of 8. GCS of 8. We must intubate. It's a good old saying. You know what I'm saying? Taylor, what is F? We don't even got that on here. Shout out to all 300 plus of y'all that are in here. If you guys are new here, make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. Right? I want to know who you are, where you're at in your nursing journey. I don't care if you're a pre-nursing student, nursing student, taking NCLEX, been a nurse for a while. You already know how we do. So appreciate all y'all. Make sure you guys go over there and check out my link tree. Got a bunch of stuff over there as well. Bellany passed that NCLEX. Yo, we had 3 people pass that NCLEX today. So shout out to you. Everybody give flowers. Give them all to them. All right. Here we go. Here's our answer, y'all. Here's our answer. Shout out to you, Bellany. Shout out to you. Welcome to the shit show. Welcome to the greatest shit show on earth of being an RN or an LPN, because LPNs are nurses too. Shout out to all my LPNs. I love each and every one of y'all. All right, here we go. The answer is D. Monitor respiratory efforts and O2 saturation, right? Who said protect that airway? That's what I'm talking about. The first priority for this patient with an SCI is assessing respiratory patterns and ensuring an adequate airway. The patient has a high cervical injury and is at risk for respiratory compromise because the spinal nerve, it affects the diaphragm. I've been an LPN for years, going back to Bridge, graduate RN next year. Shout out to you. What is that? D? Says me. Hey, yo, that's what I'm talking about. Passed that NCLEX in 2002. That was before it was on paper. No, I'm just playing. Hey, here we go. Hey, real quick break. Hey, if you guys are new here, welcome. My name is Kevin. I go by the Boot Nurse. Make sure you guys go over there and look at all my social medias. Make sure you guys participate. I'm kind of funny, kind of sort of, but whatever. Hey, the more likes that I get, the more questions that you get. I got a few in the chamber. You know what I'm saying? Hey, don't troll my chat. You troll my chat, I'm gonna ban you. I got these questions off nurselabs.com. Check out the 7-day NCLEX course. It's in its pre-launch. And if you need coaching or whatever, go check out the bootnurse.com. I'm kind of cool over there too. Here we go. All right, here we go. Question number 6. Why did I quit the ICU? Brooke, go over there and look at all of them. We ain't talking about that right now. We'll do that at a different time though. I got you. Question number 6. You are pulled from the emergency department to the neurologic floor. Which action should you delegate to the nursing assistant when providing nursing care for a patient with SCI? Is it A, assess the patient's respiratory status every 4 hours, take the patient's vitals and record every 4 hours, monitor nutritional status, including calorie counts, or have the patient turn, cough, and deep breathe every 3 hours? Everybody's screaming at me, saying B. Saying B. Okay, all right. Somebody in here said that this is fun. Hey, look, I do this Monday, Wednesday, Fridays at 5:30 Central Standard Time. So Christine and Amanda, shout out to y'all. Appreciate the follow. Let's see. All right, I'm gonna give y'all about 10 more seconds. Wilkie says C. User says B. Caitlin, thank you for the follow. Is it Corbin? Appreciate the follow. Steph. Can I call you Steph? I'm gonna call you Steph. Appreciate the follow. All right, here's our answer. You can't give me two answers. You got to give me one. Here we go. And the answer is B. Take the patient's vitals and record them every 4 hours. The nursing assistant's training and education includes taking and recording the patient's vital signs. Right now, let's go back. Let's think about this. So assessing. Can a UAP assess? Can they do that? Yes, they do select all the apply on the new NCLEX. Nursing assistants cannot assess, right? That's not part of their scope of practice. That's an RN, right? Can they take vital signs? Because that's a task that they're trained to do. Yes. Can they monitor the caloric intake, the nutritional caloric intake? Can they do that? So think about that. Okay, so can they teach a patient about turning, coughing, and deep breathing every 3 hours? You see what I'm saying? That's how you have to know. Like, they can't monitor, they can't assess, they can't teach, they can't. How does it go? You can't delegate what you eat, right? Can't delegate what you eat, right? So now think about it. This is on a national level, and it's not necessarily about what we think. It's about what the standard is. And as a UAP, a CNA, nursing assistant, whatever, according to the National Council, they cannot do it. Doesn't matter how much you want to try to argue. Appreciate all the follows. Appreciate you guys. Here we go. Question number 7. You are helping the patient with an SCI to establish a bladder retaining program. What strategy may stimulate the patient to avoid select all that apply? This is perfect. I have a test on Wednesday. Hey, shout out to Laura. See, you came to the right spot. God brought you to me. Here we go. A is stroke the patient's inner thigh, pull on the patient's pubic hair. Who came up with this question? Initiate intermittent straight catheterization, pour warm water over the perineum, or tap the bladder to stimulate detrusor muscle. So we got ADE, okay. User 57, oh, that's D. I remember now. So you came in here first. I remember your name now. So we got ADE, CDE, okay. I'm gonna give y'all about probably 20 more seconds since this is select all that apply. If you guys are new here, welcome. Make sure you guys smash that like button, share, follow. I need them all. I need all of them. All of them. All right. Here we go, y'all. We're about to come up with this answer. Here we go. In 3, 2, and the answer is A, B, D, and E. All of the strategies except straight catheterization may stimulate voiding in patients with SCIs. I know that's kind of big. So that's probably going to cost me like, no, it's not. Stop it. No, it's not. It's not going to cost you your license. It's not going to cost you your license. I can guarantee it. Hey, and this is also part of basic care and comfort. So that's one of the sections of the NCLEX PI. A lower section, right? But we don't discount the lower sections, right? Because those right there will save you. Trust and believe me. Select all the PI are the worst. I cannot deny that. All right, here we go. Question number 8. The patient with a cervical SCI has been placed in a fixed skeletal traction with a halo fixation device. Now paint the picture of what that looks like. If you don't know what that looks like, I would recommend that you go and look it up. When caring for this patient, the nurse may delegate which actions to the LPN or LVN, wherever you're located. Check the patient's skin for pressure from the device. Assess the patient's neurological status for changes. Observe the halo insertion site for sites of infection. Clean the halo site with hydrogen peroxide. I'm not pulling anything. Okay, I got you. Hey, so this is select all that apply. All right. All right, so we got skin, got AD, ACD, AC, all of them. Okay. All right, she said all of them. 83, user 83 says all of them. Okay. All right. Is it Shadeen? Thank you for the follow. Appreciate you. I'm gonna give you guys about another 15 seconds. Wouldn't you clean the halo with normal saline? I don't know. Would you? You answered your own question, sir or ma'am, or whatever you identify as. I don't know what you are exactly. So AB care. Okay. Can't assess or intervene. Okay. All right. Cool. You said A and C, or C and A, I'm sorry? C and A. See what you did there. All right, here we go. Here's our answer, y'all. Here's our answer. In 3, 2, it is A, C, and D. A is checking for signs of pressure is within the scope of practice for an LVN or LPN, right? Observing for signs of an infection is also within the scope of practice. And D is appropriate skill for cleaning the halo with hydrogen peroxide. So I've seen people do it with hydrogen peroxide. I've also seen them do it with normal saline. So that one's kind of just like, but the select all that apply are just like, they're a monster. But you know, the good thing about select all that apply now is that they're partial credit. They are partial credit, okay? So don't forget about that. But just because they're partial credit doesn't mean you want to just try to get them all wrong, or just be like, oh, that's all I know, and I'm just gonna give up on it. So, all right, here we go. Question number 9. Shout out to all y'all. Make sure you guys keep smashing that like button. You know what I'm saying? So, all right. So it's not about the fact I don't know what your name is. You got your hand like you got that emoji up, but you said you've been at LPN almost a decade, and I intervene on all. So it's not about what you do in the real world. It's about what this test wants you to do from a standard and a basic level. That's what you have to remember. All right. And you may have forgotten that, you know what I'm saying? So just to let you know that. Question number 9, you are preparing a nursing care plan for a patient with SCI, including the nursing diagnosis, impaired physical mobility, and self-care deficit. The patient tells you, I don't know why we're doing all this. My life's over. What additional nursing diagnosis takes priority based on this statement? Is it risk for injury related to altered mobility? Is it imbalanced nutrition, less than body required? Is it impaired adjustment to spinal cord injury, or is it poor body image related to immobilization? All right, let's see what y'all say. All right. Nobody forgot that wasn't time. No, I got you. I'm tracking on what you're saying. But some people aren't what's the word I'm looking for? They aren't hip to that. I'm not saying that you can't do it. I'm not saying that you can't do it. I'm just saying other people will be like, oh wait, well can't we do it? I was like, well, not according to the ACSBN. You cannot. So I got you. We good out here. I'm gonna give y'all about 10 more seconds. Mel Bell, appreciate the follow. Thank you. Yeah, I got you. Hey, it's really hard to interpret like how people talk to you via message. That's why when people tell me to hurry up, I'm just like, hey, you want to get banned? And they're like, no, I was just kidding. I'm like, oh, okay. Laura, appreciate the follow. Is it Nayo? Appreciate the follow. Mina and Miss Independent, appreciate the follow. All right, here we go, y'all. And our answer is C, impaired adjustment to spinal cord injury. The patient's statement indicates impairment of adjustment to the limitations of the injury and indicates the need for additional counseling, teaching, and support. So that's what's going to happen is like, hey, I have a spinal cord injury and I can't go back to the normal things that I used to do. And so pretty much my life is over. So now you have to get social workers up in there to, get them that help that they're going to need, to include further counseling and other, types of help that they're going to need going on at home. All right. So think about that. That's part of physiological adaptation, which is the 3rd largest section on NCLEX. All right. Appreciate y'all rocking with me. Appreciate all 200 plus of y'all. Make sure you guys are liking and smashing that like button. Which patient should be assigned to the traveling nurse new to the neurologic nursing care who has been in the neurologic unit for 1 week? All right, so they're a travel nurse, but they're new to the unit. So how will we treat them, right? A 34-year-old patient newly diagnosed with multiple sclerosis, a 68-year-old patient with a chronic amyotrophic lateral sclerosis, or ALS, a 56-year-old patient with Guillain-Barré syndrome and respiratory distress, or a 25-year-old admitted with CA-level spinal cord injury. So we got B. No lie, it says Apple user. I was about to say applesauce. Applesauce says A. I got you. Keyword is chronic, okay. Cause chronic, okay. Okay. Got A. I'm gonna give y'all about 15 more seconds. Is it Casey or Cassie? I'll say Casey. It says B, okay. All right, here we go, y'all. Here we go. Here's our answer in 3, 2, and the answer is B. And you are very much right, whoever said that this is a chronic patient. Chronic, they are stable. The traveling nurse is relatively new to the neurologic nursing and should be assigned to patients whose conditions are stable and not complex. It can't be A or B. It has to be A or B, but you can't pick both. You gotta give me one. Chronic patients are stable. Facts. That's right, Sky. All right, hey, taking a little break. Hey, so just a quick reminder, make sure you guys participate. Make sure you guys smash that like button. Give me all them likes. Don't troll my chat. Nurselabs.com is where I got these questions. Check out the 7-day NCLEX course. That link is in my bio. Also, thebluenurse.com if you're looking for tutoring, also in my bio. All right, here we go. Question number 11. The patient with multiple sclerosis tells the nursing assistant that after physical therapy, she is too tired to take a bath. What is your priority nursing diagnosis at this time? Is it A, fatigue after related disease state? Is it activity intolerance due to generalized weakness? Is it impaired physical mobility related to neuromuscular impairment? Or is it self-care deficit related to fatigue and neuromuscular weakness? I'm back. I didn't even know you left, Joanna. What you mean? Nah, I appreciate you being here. I appreciate you because I know you missed the last one. So I know you missed the last one. It's all good. Got D. Brittany says B. Shaney says A. My husband has primary. Okay, so what the answer is? Claudia says D. Troubles with AD, activity of daily living. Okay, MK. I see you, girl. All right, I'm going to give you guys another 10 seconds. See how we're doing. How we doing? What else we got? What else we got? Shout out to all 200 plus of y'all. Hey, I want to know who you are, where you're from, and where you're at in your nursing journey. Let us know. Let us know. All right, here's our answer, y'all. Here's our answer in 3, 2, and the answer is D. Self-care deficit related to fatigue and neuromuscular weakness. At this time, based on the patient's statement, the priority is self-care deficit related to fatigue after physical therapy. Fatigue is described as an overwhelming feeling of lassitude or lack of physical or mental energy that interferes with activity, right? PT gang. Shout out to the PT gang. Shout out to y'all. Took my boards in 2015. Okay, shout out to you. I graduated in December. This is super helpful as I'm preparing for NCLEX. Shout out to you, Stephanie. Shout out to you. Shout out to everybody that's going to be taking their NCLEX soon. All right. I'm an RN BSN in my second semester. Shout out to you, Miss MK. Shout out to you. Here we go. Here we go. Question number 12. The LPN LVN under your supervision as the RN is providing nursing care for a patient with GBS. What observation would you instruct the LPN to report immediately? Meaning, if the LPN sees it, hey, I need to go inform the nurse, right? Complaints of numbness and tingling, facial weakness and difficulty speaking, heart rate of 102, or shallow respirations and decreased heart sound or breathing sounds. Say D, okay. D, all right. So the first thing that we need to realize when it comes to GBS is what are the expected signs and symptoms of somebody with GBS. Once you understand what that is, you'll be able to dissect this question. I'm a huge content person. I'm not all about the tricks. I'm not all about nothing. So you have to be able to apply what you know. And everybody in nursing school, at least for the most part, should know what GBS is and what the expected signs and symptoms of that looks like. So if it's not expected, then you know that's your correct answer. All right, so here's our answer. Ascending weakness, okay. ABCs, okay. All right, when in doubt, see your, what? Stop it. When in doubt, see, John, I mean, you're wrong, but you're not wrong, you know what I'm saying? So, but all right, here we go, y'all, here we go. Here's our answer in 3, 2, and the answer is D, shallow respirations and decreased breath sounds, right? The priority intervention for the patient with GBS are aimed at maintaining adequate respiration function or respiratory function. These patients are at risk for respiratory failure, which is urgent. Upon presentation, 40% of patients have a respiratory or oropharyngeal weakness. Ventilator failure with required respiratory support occurs in up to 1/3 of patients at some time during the course of their disease. Hey, so shout out to, hey, if I got any RTs up in here, shout out to y'all, because you already know y'all be putting these folks on event. You already know what the deal is. Rebecca, appreciate the follow. Thank you. All right. Hey, and this is part of the reduction of risk potential. Okay. So just to let y'all know, when my review comes out, my review is going to be broken up by the 8 client needs. You know, the 8 sections of the NCLEX pie, and that's coming here soon, here within the next couple of weeks. So just be, hey, giving y'all a shout out, letting y'all know what's up. Here we go. Question number 13. The nursing assistant reports to you, the RN, that the patient with myasthenia gravis has an elevated temperature of 102.2 Fahrenheit and a heart rate of 120 beats per minute, a rise in blood pressure at 158 over 94, and was incontinent of urine and stool. What is your best first action at this time? First of all, I don't even like the way that last part is written. What is your best first action? It's either on NCLEX, it's going to be either your best or it's going to be your first, not both, because that is a confusing, stupid way to put that. Do we give the acetaminophen suppository, notify the provider, recheck vitals every hour or within an hour, or reschedule patient's physical therapy session? So we got B. Court, appreciate the follow. Thank you. Shout out to you. Somebody gave me a rose earlier. Who gave me a rose? So I can give you a shout out. So I can, appreciate you. Shaney says B. Okay. Casey Ann says, oh, appreciate the follow. My mom has myasthenia gravis. Glad to see people are learning about rare diseases. So it's actually a part of nursing curriculum when they're doing neuro about myasthenia gravis. Like, it's one of them. It's one of those very important ones. And when I was working in the neuro ICU, I saw a good, probably 3. I saw 3 people with myasthenia gravis. So, all right, here we go. Here's our answer in 3, 2. And the answer is notify the provider immediately. The changes that the nursing assistant is reporting are characteristics of a myasthenia crisis, which often follows some type of infection. The patient is at risk for inadequate respiratory function. In addition to notifying the physician, the nurse should carefully monitor the patient's respiratory status. The patient may need intubation and mechanical ventilation. So, hey, where my RTs at? You know what I'm saying? RTs are at all those codes or all those, rapid responses, just, for that reason alone. So they're about to have a crisis. Yes, they are. Yes, they are. And this is part of physiological adaptation, which is the 3rd largest section on NCLEX. Okay. Appreciate all the follows. Thank you, guys. All right, here we go. Question number 14. You are providing care for a patient with an acute hemorrhage stroke. All right. An acute, meaning happening, stroke happening, right? The patient's husband has been reading a lot about strokes and asks why his wife did not receive, Adaplace. There you go. I always mispronounce it, but it doesn't matter. What is your best response? Your wife was not admitted within the time frame for that medication to be given. This drug is used primarily for patients who experience an acute heart attack. It dissolves clots and may cause more bleeding into your wife's brain. Your wife had gallbladder surgery about 6 months ago, and this prevents the use of the medication. So what is it? So we got C. Everybody's screaming C at me. LOL C. Look, hey, I ain't never been in no spelling bee. So I'm just saying, if we don't know how to pronounce something, that's okay too. As long as it looks familiar and you know what it is. And wait till you get to pharmacology and you start learning about, chemotherapy drugs. You're gonna be like, how in the hell do I even say that? All right, we got C's. I'm gonna give you guys another 15 seconds. Appreciate everybody jumping in here. Hey, if you're new here, smash that like button. Make sure you guys share. Make sure you guys follow. I need all them likes, all of them. If you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Appreciate the shares. I don't care if you're a pre-nursing student. I don't care if you are in nursing school. I don't care if you've taken the NCLEX or if you've been a nurse for 40 years. Let us know. Here's our answer. The answer is C. It is a clot buster, right? With a patient who has experienced a hemorrhagic stroke, there is already bleeding in the brain. A drug like this will worsen the bleeding, right? So it will prevent it from clotting. So yeah, we gotta keep it going. See, social work. Oh, okay. Shout out to you, Mel Bell. Okay, Cameron from Alabama. Okay, starting nursing school in January. Shout out to you, Cameron. Cameron, just make sure you go get you a folding chair because I know how you folks in Alabama like to be. You know what I'm saying? I'm just playing, y'all. All right, here we go. Just a tech here. Hey, don't tell me just a tech. Let me tell you something right now. When I worked ICU, I wish I wish everything that I wish that I had a tech. I wish. Level 1 ER trauma nurse. Shout out to you. All right, final semester nursing school, Boise, Idaho. Okay, it's blue up there, like the football field. So, hey, this is part of pharmacology, by the way, 2nd largest section on NCLEX. All right, here we go. Question number 15. You are supervising a senior nursing student, which is some of y'all that are in here, who is caring for a patient with a right hemisphere stroke. Which action by the nurse or by the student nurse requires that you intervene? So the focus of this question is, what is the nursing student doing wrong, right? And what do I need to do as the RN to fix that? Jordan, shout out to you taking NCLEX A on Wednesday. You better not be here. You better not be here. I do these lives every Monday, Wednesday, Friday, Alyssa, 5:30 Central Standard Time, Texas time, because the only time that matters. Is it A, the student instructs the patient to sit up straight, resulting in patient's puzzled expression? The student moves the patient's tray to the right side of her overbed tray. The student assists the patient with passive range of motion exercises. The patient combs the left side of the patient's hair with the patient's comb only the right side. So it says D, encourage patients to do it through neglect. Got A, okay. Stephanie says A, okay. Shout out to all 200 plus of y'all. Mel says A. Right is restless, okay. Is it Nicolina? Says A. Yeah, that's some unique names. That's the first time I ever heard that. Two shoes. Okay, well I think I've seen two shoes in here before. Taste the biscuit. Jesus Christ. Okay. Says A. All right. Sheena. All right. Cool. Normal name. Got you. A. All right. Hey, if you guys are new, make sure you guys like, share, follow. I need all of them. Happy. Appreciate the follow. Matt. Appreciate the follow. Here's our answer, y'all. Here's our answer in 3, 2. And our answer is A. The student instructs the patient to sit up straight, resulting in the patient's puzzled expression. Patients with right cerebral hemisphere stroke often present with neglect syndrome, right? Somebody said that already, right? Appreciate the follow, Alyssa. They lean to the left, and when asked, respond that they believe that they are sitting up straight. They often neglect the left side of their body and ignore food on the left side of their food tray. The nurse would need to remind the student of this phenomena and discuss the appropriate intervention. Hey, if you don't know, you don't know. That's why you ask. I'm all about it. If anybody has seen my video where it says why I quit the ICU part 7, if you don't know, you better open your mouth and you better say something to somebody. Level 1 neuro ICU nurse here, definitely A. Shout out to you, Taylor. That is definitely A. Appreciate all the follows. Let's go on to the next one. Hey, quick break. Hey, we're doing NCLEX questions. Make sure you participate. I'm kind of funny. Kinda. It's Monday, but whatever. Give me all the likes. I need all the likes. Smash the like button. Don't troll my chat. I got these questions off nurselab.com. Check out the 7-day NCLEX course, which is in its pre-launch, so we're still building it, but there are things that are available. Check that out in the bio, as well as if you want one-on-one coaching for NCLEX, bootnurse.com. All right, here we go. Question number 16. Hey, friend, what's up? How are you? Who is that? Codex and Maddie, appreciate the follow. Or Mandy, appreciate the follow. Question number 16. Which of the following arteries primarily feeds the anterior wall of the heart? All right, is it the circumflex artery, the internal mammary artery, the left anterior descending artery, or the right coronary artery? Now, as you guys answer this question, I'm going to ask you a question. Do you think that this question is a passing level question on NCLEX? Got C's, got D's. Okay, let me give you guys about another 15 seconds. Is it Chelly? Appreciate the follow. Wait, no C. Okay, Steph. All right. Got C. Okay. Got C. Okay. Appreciate all 200 plus of y'all up in here. If you guys are new here, make sure you guys like, share, follow, smash that like button. I want to know who you are, where you're from, where you're at in your nursing journey. What do you mean by passing level questions? So on NCLEX, you have passing level questions and you have non-passing level questions. So would this be considered a passing level question? A passing level question consists of analysis and application, which involves critical thinking and clinical judgment. Does this question, do you believe, does it fit within that criteria? All right, here's our answer. Here's our answer in 3, 2. The answer is C, left anterior descending artery. The left anterior descending artery is the primary source of blood from the anterior wall, or for the anterior wall of the heart. The left anterior descending artery branches off the left artery, or the left coronary artery, and supplies blood to the front of the left side of the heart. The answer was in the question. Look at that. Look at that. And so I'm going to elaborate. You think it's a passing level question. So here's the thing: is like where do you learn this at? Right now, on NCLEX they have it's based off of kind of like a pyramid. So you have remembering, you have memorization, you have application, and you have analysis. At what point in time is this considered, using clinical judgment and critical thinking? AMP is my nightmare. What's my nightmare? Chemistry. I didn't like it. So think about that. Now, if you start getting questions like this on NCLEX, you may want to reevaluate what you're doing. It's a memorization question. That's right? It's a memorization question. That was not a passing level question, right? Because I need to know that you need to know what the steps are when it comes to critical thinking. If I put a patient in front of you that has, a hemorrhagic stroke, like what is the first thing that I do if I have a patient that's having a hemorrhagic stroke if I'm working, in the emergency department? Okay, so here's our question. Question number 17. When do coronary arteries primarily, when do they receive blood flow? During inspiration, diastole? I forgot. It doesn't matter. Expiration or systolic? Probably B. You know what? Probably right. So everybody's saying B. Okay. Well, I say some other folks say C up here, I think. I take my NCLEX on Wednesday and I'm so nervous. Crystal, don't be nervous. You're gonna do just fine. Thank you for explaining not passing level then. Yep, it's not passing level. All right, it's not C. Okay, got you. Jordan says B. All right. Shout out to all 241 of y'all in here. All right. So understand what the what the questions, the level of questions that you guys will get asked. Somebody says D on here. All right, y'all. Here we go. Here's our answer. Here we go. In 3, 2, and our answer is B. It's during diastolics, during the bottom number of your blood pressure. Okay. Although the coronary arteries may receive a minute portion of blood during systole, most of the blood flow from the coronary arteries is supplied during diastole. Obviously, I'm just having a rough time. Y'all hear my son crying over there? Obviously, he don't know how to act. Diastole. First of all, don't. Hey, I love the way that you put that. Hey, I'm gonna be your friend now. Diastole. Blah 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 blah. Appreciate the follow. All right, here we go. Question number 18. Which of the following illnesses is the leading cause of death in the United States? Is it cancer, coronary artery disease, liver failure, or renal failure? It's hard. I know it's hard out here. I don't appreciate y'all laughing at me, okay? CAD. All right. B. Okay. B. Okay. So now this is a textbook of a memorization question. I think we can all agree with that, right? And I'll give you a prime example. When I took my NCLEX my second time, I got questions like this, and I had to stop, and I was just like, "Oh hell, I'm not doing well." Right? So that's how you have to think of it, right? You want those difficult questions, okay? So everybody's screaming at me. B. Kelly, appreciate the follow. Thank you. All right, here we go. Here's our answer in 3, 2, and the answer is coronary artery disease, which accounts for over 50% of all deaths in the United States. I don't know why that came out small. Sorry. And that's part of health promotions and maintenance. Although I'm amazed at the amount of people in the dialysis in the world, right? Yup. Cancer, a while to kill. Yeah, it does take a while to kill. God. Hey, you want to know why? Hey, who can tell him why 50% of people in the United States die from coronary artery disease? Let them know why. All right, here we go. While you guys answer that why. Obesity, right? Sedentary lifestyle, processed foods, lack of education, which is a big one, right? Like I live in San Antonio, and about 65 to almost 75% of the population in San Antonio have diabetes due to lack of education and lack of mobility, lack of, what they say, time, you name it, right? Yeah, lack of access to healthcare, right? I would put that one part of education as well too. Like all other things, yep, it takes a while to kill. Yep, lack of education is terrible in rural areas. I believe it. They don't believe in that their internet's out there. You know what I'm saying? So, yep, sedentary lifestyle, that's a fact. And Americans, y'all need to get off your ass. You know what I'm saying? Get off of it. All right, here we go. Which of the following conditions most likely Oh, I'm sorry, most commonly results in CAD. Is it diabetes, arthrosclerosis, MI, or renal failure? Appreciate the share. Appreciate the share. If you guys are new here, make sure you guys are sharing, and smashing that like button, and make sure you guys are following. The more that you guys share, follow, and like, the more the algorithm pushes, and we get more folks out here. Just talk about let's go. Just talked about this. Let's go. Okay, shout out to you, Joanna. All right, I'm gonna give you guys about 15 more seconds. No, I mean, I'm not even about to do that. Y'all should already know this answer. All right, here we go. The answer is A. Arteriosclerosis or plaque formation is the leading cause of CAD. So all them cheeseburgers that you like to eat, you know what I'm saying? All the pizza. I'm not. This is no shade, but we have a lot of traditions in our cultures. Doesn't matter what culture that you're in, that people don't want to give up. Like, hey, in the black community, we like deep frying stuff. You know what I'm saying? Hey, in the Hispanic community, they like deep frying stuff. They like chorizo and egg tacos. So do I. Cholesterol. You know what I'm saying? It get crazy out here. So you gotta hone it back in. And when you hone it back in, you gotta change some stuff up. All right. You gotta live out here, especially if you got kids. You gotta live for them. So, all right. Question 20. Arteriosclerosis impedes coronary blood flow by which of the following mechanisms? Plaque obstruction in the veins, obstruction in the arteries, blood clots from outside the vessel walls, or hardened vessels dilate to allow the blood to flow through. D or B, coronary artery disease. Okay. We got B. Okay, Mackenzie says B. Okay. Mrs. Stevens says B. Ashley says B. Okay. All right. Okay. Your review helps. I got a 99 on my nursing exam and a 91 on my second one. Shout out to you. Shout out to you, Ashley. I'm glad it helps. I'm glad it's helping. I really do. This is why I like to do this, because I know that it helps you guys. All right, here we go. Here's our answer in 3, 2. And the answer is plaques obstruct the arteries, right? Arteries, not veins, supply the coronary artery with oxygen and other nutrients. Arteriosclerosis is a lipoprotein-driven disease that leads to plaque formation at specific sites of the arterial tree through intimal inflammation, necrosis, fibrosis, and calcification. I'm Cuban, and man, it's so hard to diet. My cholesterol is not doing well. That's what I'm trying to say. It's like we have a lot of these cultural traditions that we do that that make it seem like it's okay for us to live that way, when in reality it's not. Like, you got to change. It's okay to do those things in moderation or every so often, but most definitely not all the time. So hey, we're doing NCLEX questions. Make sure you guys participate. Make sure y'all smash that like button right now. Do it right now, because I love you. So give me all them likes. Don't troll my chat. Everybody's been wonderful today. I appreciate it, because if you're not, I'm gonna ban that ass. I got all these questions off nurselabs.com. They are free. They have tons of them over there, so go over there and look at them for yourself. Also, check out the 7-day NCLEX course. We are still in our pre-launch phase, adding content every week to 2 weeks to monthly, but it's been consistent every 2 weeks. So make sure you guys go over there, check that out. And if you're looking for one-on-one tutoring, go check out thebluenurse.com. Here we go. Let's go. Appreciate the follow, appreciate the like, appreciate the follows. Here we go. Question number 22. Which of the following risk factors for coronary artery disease cannot be corrected? Is it smoking cigarettes, diabetes, hereditary, or HPN? What are we thinking? I'll give you guys 20 seconds. Do you have a farm review? I take the proctored ATI on Thursday. Steph, I don't have a farm review as of yet, but we're working on that. Wait, are you talking about a farm review like in my course, Steph? Is that what you're asking? The NCLEX is the nursing exam. You must not be a nurse or anything like that. So, oh, in my program, yeah. So I have a pharmacology section in there. I have a farm section in there. All right. So here we go. Here's our answer. In 3, 2. And the answer is C, hereditary, because hereditary refers to our genetic makeup, and it cannot be changed. So what type of question do you think that was? Just took the NCLEX this morning. Shout out to you. Is it AI? How do you think you did? Let us know how you did. I'm going into teaching, so hope not a nurse. Okay, that's okay. I'm actually an instructor too, so yeah. Going into teaching, go out there and teach these babies. Do you have a maternal nursing in your program? I have maternal lectures, but they are not in production as of yet. My main priority right now is to get the actual NCLEX review with NGN stuff out there. That's my main priority, but the maternity stuff is coming out. I thought hypertension was HTN. It is. Who knows with these questions? Hey, sometimes the questions aren't going to be all that great, and that's just kind of how we are, right? That's just kind of how it is. So here we go. Question number 22. Exceeding which of the following serum cholesterol levels significantly increases the risk of coronary artery disease? Which one? So which one is too high? Is it 100, 150, 175, or 200? This is a memorization question, a remembering question. All right? So just to let you guys know, as a collective, we're all not doing well on this damn exam. Because remember, the exam, if you don't know, the exam is computer adaptive. Everybody starts above the passing line. Now, depending on how you answer that question will determine if you go up, if you stay above the line, or if you start to trend down towards the line. No idea. Everybody's saying D, so D. Okay, Joanna, we're just going to follow the crowd and do what we want or whatever. Okay. The next generation NCLEX is going to have the lab ranges. Yes, they are going to have the lab ranges. 100%, Kelly, they are. Now, the question is, what do you do when the labs are out of range, if they're too low or too high? That is what's really killing people. Here's our answer, y'all. Here's our answer. In 3, 2. The answer is 200. 200. Cholesterol levels above 200 milligrams per deciliter are considered excessive. They require dietary restrictions and perhaps medication. Exercise also helps reduce cholesterol levels. The other levels listed are all below the nationally accepted level for cholesterol and carry a lesser risk for coronary artery disease. The normal level of serum cholesterol is between 125 and 200. Good, because I don't have to memorize. So here's the thing, like I said, it's not about memorizing, right? But you need to know what the ranges are on top of what it's going to look like when they're above the range, right? How much is your review? Right now, my review is $97. It was $48 for the first 3 months, and now it is $97 and once you get it forever. So it's yours. So here we go. Here is our question. Damn, I made that one big. Brittany, appreciate the follow. Thank you. So here's our question. Question number 23. Which of the following actions is the first priority care for a client exhibiting signs and symptoms of coronary artery disease? So what is the very first thing? What is the first thing that we do? Decrease anxiety, enhance myocardial oxygenation, administer sublingual nitroglycerin, or educate the patient about his symptoms or her symptoms or whatever. You know. Jessica, thank you for the follow. Appreciate you. Appreciate you. Randy, thank you for the follow. Appreciate you. So think about it. My man has coronary artery disease. What is it affecting, and what is our primary thing? Apply what you know. Apply what you know based off of the content and the knowledge that you have acquired. Okay. So we got B's, we got D's. Is it Langley? Appreciate the follow. Got B, B, B. A lot of C's and a lot of B's, a lot of D's. Okay. All right. All right. All right, y'all. Here we go. Here's our answer. Here's our answer in 3, 2. Coronary artery disease is the same as heart disease. ABC is oxygenation to the heart. Well, let's see. ADPI. You can never go wrong with ADPI, right? So here we go. Enhanced myocardial oxygenation, right? Enhanced myocardial oxygenation is always the first priority when a patient exhibits signs and symptoms of cardiac compromise. So whoever just asked me that question, if it's the same as heart disease, Joanna, then your answer is yes. There it is. Without adequate oxygen, the myocardium suffers damage, just like the brain and everything else. Yeah, with ADPI, you can never go wrong. You know, with ADPI and Maslow's, right? So, you know, assess, are we going to assess or are we going to implement, right? So what are we going to do first? Like, do we need more information, or do we have enough information to where we can then take action, right? And if you need to do more further assessing, okay, cool, let's go to Maslow's. Like, what takes priority? Is it physical or psychosocial? What's more important, the physicality of the patient or the patient's mental state? As in, like, oh my God, my toes hurt, right? I don't care about your toes hurting. I just need to make sure that you're breathing correctly, right? Exactly my point. Exactly my point. All right, here we go. Shout out to y'all. Make sure you guys like, share, smash that like button. Shout out to all 200 plus of y'all. I want to know who you are, where you're from, where you're at in your nursing journey. All right, medical treatment of coronary artery disease includes which of the following procedures? Is it a cardiac catheterization? Is it a coronary artery bypass surgery, or CABG? You'll hear it called CABG, or CABG. Oral medication administration, or percutaneous transluminal coronary angioplasty. Whoever came up with all these medical terms, they're terrible. They're terrible people, I tell you. All right, so we got B. All right, what else we doing? I'll give you guys another 20 seconds. LPN in the RN program now in Missouri here. Shout out to you. Red. Like Red. What's that girl name? Is it Sexy Red? I'll call it. All right. That's your name from now on. Sexy Red. Depends. Okay. No, there is no depends. There is no depends. I mean, it does depend, but don't put any more in there that doesn't need to be in there. Wyoming. Shout out to, I think I was in Wyoming. Hey, isn't the Devil's Tower in Wyoming? How severe is the disease? I don't know. That's not the question that they're asking you. Almost halfway through my second year program. Shout out to you. All right, cool. Here we go, y'all. Here we go. Here is our answer. We're going to give our answer. Here it is in 3, 2. So the answer is oral medication administration. So yeah, you are correct. It does depend. It does depend, right? Depends on the level, right? But oral medication administration is non-invasive. Medical treatment for coronary artery, for coronary artery disease. Nitroglycerin is the most common vasodilator used for acute cases of angina. It works to dilate or widen the coronary arteries, increasing blood flow to the heart muscle, and to relax the veins, lessening the amount of blood that returns to the heart from the body. This combination of effects decreases the amount of work for the heart. I knew it, but I got it wrong, ma'am. The question is, so that's the thing, Alba. The question is, and you will get questions that are misleading, and you will get questions that are confusing. Not all the questions are perfect. And while you guys are studying, it's going to happen, right? If you're studying 100 questions, there'll probably be 5 or 6 of them that won't make sense. But well, it won't make sense. But all the other, 94, 96 of them, or 94, they're all going to make sense. Okay, so we won't just get hung up on that one. I didn't like the way that one was either, because it doesn't give you enough context. The great thing about NCLEX is that it gives you more context in your questions, right? So what is the first line of treatment? I agree with you. I do not disagree with you on how that is worded. So here we go. Question 25. Prolonged occlusion to the right coronary artery produces an infarction in which of the following areas of the heart? Is it anterior, apical, inferior, or lateral? Hey, Tasha, just like the NCLEX, we don't go back on questions. And I mean that with all due respect. I don't want you to think I'm yelling at you. So appreciate all 224 y'all in here rocking with us. Make sure you guys like, share, follow. My name is Kevin. Go by the Boot Nurse. Check me out on YouTube. Hey, if you know anybody that needs this, make sure you guys share it. And I put up all of these on YouTube. So if they miss them, they can go back and they can look at them. Alyssa, appreciate the follow. Thank you. Everybody, for the most part, is saying C. Okay. All right. So what type of question do you guys think this is? Do you guys think this is a passing level question? This is a question that works really well during nursing school, right? But on NCLEX, probably not doing so hot, right? Juan says A. Okay. All right, y'all. Here we go. Here's our answer. In 3, 2, and the answer is C. It is inferior. The right coronary artery supplies the right ventricle or the inferior portion of the heart. Therefore, prolonged occlusion could produce an infarction in that area. Well, we don't want that. We don't need no muscles dying around here. All right. Do more questions if you want. I am. What you mean? All right. Hey, here we go. Hey, doing NCLEX questions. I appreciate y'all participating. Make sure you guys like, share, follow, smash that like button. I need all the likes. I need all the love. So participate. I love y'all's participation. Give me all them likes. Don't troll my chat. Questions off of nurselab.com. 7-day NCLEX course. Check the link in my bio, as well as bootnurse.com. There we go. Here we go. Question number 26. Which of the following is the most common symptom of myocardial infarction? I thought you only did 25. My bad. Oh, that's why you're telling me to do more questions? Look. Hey, you already know certain times are limited, ma'am. Red says A. Jordan says A. Claudia says A. Okay. You had a what? Somebody said they had a bypass in 2015. Chest pain. Okay. Sassy Cinnamon, you with the answer. All right, cool. Infarction sounds so fun to me for some reason. That's because it does. So walk around, start saying, "Hey, I had an infarction." People are gonna look at you like you're crazy. Oh, see now that makes sense, Alva. Okay, I see you. See, bring the expertise up in here. Hey, look, I love it. To be honest, like I do. All right, here we go, y'all. Here we go. Here's our answer. In 3, 2. And our answer is chest pain. The most common symptom of an MI is chest pain, resulting from the deprivation of oxygen to the heart. So think about those previous questions. It's like, hey, the first part of when stuff starts going on with the heart is oxygen demand. We need to keep that oxygen up. The classic manifestation of ischemia is usually described as heavy chest pressure or squeezing, a burning feeling or difficulty in breathing. The discomfort or pain often radiates to the left shoulder, neck, or arm. Chest pain may be atypical in a few cases. It builds in intensity over a period of a few minutes. Hey, and then sometimes you'll feel, like females will feel it in the middle of their back. You know what I'm saying? So, and then also depends on, what other type of cardiac issues that they may have, depending on where they will feel them. So, Caroline, appreciate the follow. Thank you. So here's our next question. Shout out to all of y'all. Can everybody see that? I think everybody can see that. We have to back it up a little bit. All right, here we go. Which of the following landmarks is the correct one for obtaining an apical pulse? Is it the left intercostal space, mid-axillary line? Is it the left fifth intercostal space, the mid-clavicular line, left second intercostal space, mid-clavicular line, or left seventh intercostal space, mid-clavicular line? All right, everybody's saying B. Now I'm going to ask you this question again. Claudia, you ain't got to scream at me. I see it. Oh my goodness. All right, so here's my question. If you don't know, that's okay. So who is that? Shell Marie, appreciate the follow. Alexis, appreciate the follow. So is this a passing level question? Not passing level question. All right. So now let me redirect you, or let me repurpose this question. What if I had a picture of a patient up here, and I had it was one of those clicks, like where you click it and you tell me like where it's at? Would that be a passing level question? Because remember, they can ask. It's all about how the question is delivered to you. It's better in a picture. So a picture question actually is better. It's actually better. And that one would actually constitute as a passing level question. It's still memorization, correct? Yeah. But it's actually more of a passing level question than the way how this one is formatted. All right. So here we go. Let's check this answer out. Let's check this answer out in 3, 2. So the answer is B, left fifth intercostal space, mid-clavicular line. The correct landmark for obtaining an apical pulse is what I just stated. Yeah, is where we at? Yeah, where we just said mid-clavicular line. This is the point of maximum impulse and the location of the left ventricle apex. Sorry if you guys hear my son. He in there screaming. He obviously is crazy. Starting to study for my CCRM, ma'am. You're gonna rock that. You're gonna rock that thing. Go rock that CCRM, and then keep teaching. I know you out there teaching. All right, here we go. Question number 28. Which of the following systems is the most likely origin of pain the client describes as knife-like chest pain that increases in intensity with inspiration? Not me thinking that it was your wrist. What? Oncology nurse here asked something about chemo. Well, I don't got no chemo up in here. We don't got no chemo. No chemo questions. It's funny because I was actually doing recording a chemo lecture yesterday, talking about immunomodulators and all that good stuff. So, them drugs are a monster. Let me tell you, those drugs are. I literally wish, man, I do not remember how to say these, but they're a lot. So shout out to you, oncology. Pulmonary, okay. Joanna says D. Bree says A. Okay. Jordan, appreciate the follow. Thank you. D, P, E, okay. Oh, you're just left PE. Okay. I'm doing CVA and PE for now. Okay. Pressure is cardiac. Jordan, appreciate the follow. All right. It looks like we're kind of all over the place. So, Jason, my man, appreciate you being here. I know you're out there doing your thing. So here we go. Here we go. Here we go. Here's our answer in 3, 2. And the answer is pulmonary, right? Pulmonary pain is generally described by these symptoms. Pain may originate from several different structures within the chest, including the skin, ribs, intercostal muscles, pleura, esophagus, heart, aorta, diaphragm, or thoracic vertebrae. The pain may be transmitted by intercostal, sympathetic, the vagus, or the phrenic nerves. The innervations of the deep structures of the thorax follow common pathways to the central nervous system, making it difficult to localize the source of the pain. I still got it. That's all that matters. That's all that matters. You still got it? Look, I'm saying, hey, come on, hey, you know the deal. Y'all know the deal. Shout out to all 260 y'all up in here and rock with me. If you guys are new, make sure you guys like, share, follow, smash that like button. Sexy Red gave me a rose. That's what I'm talking about. I appreciate you. And here we go. Question number 29. A murmur is heard at the second left intercostal space along the left sternal border. Which valve area is this? Y'all already know what type of question that this is. However, if you're in nursing school, this is helping you out tremendously. And if you get a question like this on NCLEX, you better just stop what you're doing and take a breath. Stop what you're doing and take a breath, okay? All right, we got C, we got A, okay. ATEMP. Oops. Got C. I give y'all 10 more seconds, okay? Jason says C. Scorpio Princess, what's up? Says C, okay. Hey, when I see a lot of regulars, you already know I gotta give y'all some love, give y'all some shout outs. All right, we got D. Haven, why are you yelling at me? Jackie says C. People in nursing school now. People gonna know A. Nobody that knows anatomy thinks B. Nah, what's up? All right, Miss Bean says D. Jackie says C. Okay, cool. Here we go. Here's our answer in 3, 2, and the answer is C. Pulmonic. I don't know if you guys can see that. It's a lot to read. I'll read it anyway. Abnormalities of the pulmonic valve are auscultated at the second left intercostal space along the left sternal border. Murmurs of the cardiac system develop due to alterations in blood flow or mechanical operation. Murmurs develop from a multitude of mechanisms. Typical cases include, a low blood viscosity from anemia, septal defects, failures in the ductus arteriosus too close in newborns, excessive hydrostatic pressure on cardiac valves causing valve failure, hypertrophic obstructive cardiomyopathy, and valvular specific pathologies. I'm telling you, all physicians take money. Yeah, they do. Abbreviations. Oh, okay, I got you. Yeah, however you need to remember it for yourself. However you need to remember. Hey, so guys, remember when you guys are studying, it's so important that you guys read your rationales of why that answer is correct. Even if you got it correct, read it, right? If you got it incorrect, read it. But then also, for all people, make sure you guys read these ones on why you got them incorrect. That is how you are supposed to study. That's how you remember it. Facts. That is how you retain the information that you're learning. My old lady has a Did you give her a heart murmur or what? Oh my goodness. All right. Which of the following blood tests is most indicative of cardiac damage? What are we thinking? A, B, C, or D? What are we thinking? Mackenzie says C. Miss Stevens says C. Cat Blackwood. I was about to say Black Catwood. I don't know why. It's my dyslexia acting up. These are easy. They are easy. These are not my questions. These are easy questions. Finally, one I know. So here's the thing: if you're doing your NCLEX and you get a question like this, and you're just like, "Oh yes, finally one that I know," you really might want to take obviously in the testing center you can't take a step back, but you might want to mentally take a note, as in like, "Bro, I am not doing well on this exam at all." NCLEX is pretty easy and basic. It depends on who's taking it. Is it Kenya? It depends on who's taking it. Maybe easy for you, but I can guarantee you it's not easy for a lot of people. If it was easy, everybody would pass it. And if it was easy, then, they would have 100% pass rate, across the entire nation and not an 87% pass rate. All right, here we go, y'all. Here we go. Here is our answer. Here's our answer in three. Tiffany, thank you for the follow. In 3, 2, and our answer is C. It's troponin. I started stuttering like fucking Bobby Boucher. Lord have mercy. All right, here we go. Troponin level 1 rise rapidly and are detectable within 1 hour of a myocardial injury. Troponin 1 levels aren't detectable in people without cardiac injury. So you have somebody that's coming in with like a STEMI, NSTEMI, and they tell you, oh, I've been feeling this way for however long. The first thing that they're drawing, that's one of the first things that they're drawing. That's one of the first things that they're drawing. Okay? Somebody said I got it in a select, I'll let it apply. Crazy. The troponin complex consists of 3 subunits: troponin C, troponin, is it I or 1? I just say 1, and troponin T, whatever. And is located in the myofibrillar thin fibrillin and the striate muscle. Oh my God, that's all over the place. The cardiac isoform tropin T and I are only expressed in cardiac muscles. Hence, cardiac troponin T and I are more specific than creatinine kinase values for myocardial injuries, and because of their high sensitivity, they may even be elevated when the concentration's not there. So there's that. All right, that's all. That's too much. That's too much to be reading. But anyways, so risk or reduction of risk potential. That is the section that it's in. Make sure you guys read it. Obviously, I'm starting to get camera shy and stage fright because I don't know how to say some stupid words. But it's all good. So, but yeah, make sure you guys look at your rationales and you read them. Even if you've got them correct, you have to read them. Okay. And that, ladies and gentlemen, is a wrap on the questions for today. I appreciate you guys hanging out. We're about to do the Ask Me Anything portion for about the next half hour or so, depending on how many questions you guys ask me. But I appreciate all the love. I appreciate all the follows. You guys can keep smashing that like button. I didn't have to ban nobody, which was great. So also go check out nurselabs.com. That's where I got it. Hey, also, I did that nursing summit yesterday. If you guys can still go register for it, and you guys can see it. It is on demand, so you guys can go watch it at your leisure. 7-day NCLEX course and thebootnurse.com. Both those links are in my bio. You guys can go over there and check that out. My next live is going to be on Wednesday at 5:30. That's when it's done. So, shout out to all y'all. Next live. Who else doing live? Who else live with me in the NCLEX? Hey, I'm just saying. Your sound is like a little, oh, okay, my bad. Let me know if it's good. How y'all doing? Welcome. Hey, so we're essentially doing Ask Me Anything right now. If you guys don't know, my name's Kevin. I go by the Boot Nurse on all platforms, so YouTube, Instagram, whatever. So I want to know who you are, where you're from, where you're at in your nursing journey, what questions that you guys have. Are you a pre-nursing student? Are you a nursing student in school right now? Are you about to graduate? You about to take that NCLEX? All that good stuff. What's up, Shelby? How are you? Hell, even the nurses that have been in here for a while. Somebody just said that they were a CVICU nurse. You know what I'm saying? So Minnesota student, new grad. Shout out to you. I have a lot of people coming here saying where should I go? Where should I work? I'm always going to tell anybody, you can go wherever you want. 31-year veteran from Ohio. A veteran of what? Of nursing or military? I mean, that's a legit question. So, Essex County. Okay. Or Essex County college student. Okay. Shout out to you. Nursing. Okay. I got you. In my first year. Okay. They gatekeep all the ICUs in Colorado. Actually, that's actually unfortunate because I'm a firm believer that it doesn't matter where you go. You can still learn how that goes. There's people that go straight to labor and delivery. They'll get a labor and delivery job and will do all of labor and delivery their entire career and they didn't have to go to med surg. So I hate it when people say, hey, you need to go to med surg. You don't need to do anything. But med surg is an opportunity, and med surg is a specialty. People forget about that you can get certified as a med surg nurse. All right. I don't shit on med surg. I just knew that med surg was not for me. So, what does that say? NCLPN currently taking RN NCLEX soon. Shout out to you. Victoria, Texas, pre-nursing student. Should start next August. I don't know how I'm going to pay my bills. Ma'am, you better figure out how to pay those bills because you got to eat, you got to live. You got to eat and you got to live. The recruiters are big haters. They push med surg. So here's the thing: is like if you want to go to med surg, cool. Or if they make you go to med surg, and if that's the only place that you want to go, or that they have available for you, and you need to work, do what you need to do for yourself. I have psych clinicals tomorrow. Look, psych clinicals. Hey, so when you guys go to psych, any of my nursing students in here, so obviously, especially my females, tie your hair up. Like this ain't. I know. Hey, look, I know we want to try to go out there. I ain't saying we because obviously I don't got that problem. I ain't doing all that shit, right? So, but tie your hair up. Like it's like you ain't tie your fucking hair up because somebody gonna snatch that ass up. And I've literally seen it. I have literally seen on in psych where a girl had her hair all down, thinking she was all cute, and then somebody yanked her ass up. I'm just saying, look, there's a time to be pretty and it ain't fucking there. So I'm just being completely honest. Tips to get used to bad smells and bad sight wounds and trauma. So country boy, what I would tell you, like for really good smells inside, if you wear obviously when you're wearing a mask, sometimes I'll pop a Jolly Rancher in, or during COVID when I was working, when I had COVID and during C. diff patients, especially C. diff patients, I would take Mastisol, and I would rub it on the inside of my mask, and I'd just be smelling that the whole time instead of just smelling nastiness. When it comes to bad sights and wounds, in order to get over that, it's just you need to be exposed to them. That's how you develop a numb feeling to it, to be completely honest. Yeah, and keep your stethoscope off of you if you're doing psych, because that will become a weapon. I don't know why people do that anyway, because unless you're cleaning it all the time and unless you're self-conscious about that, I would not keep it around my neck, because any patient can use that as a weapon on you. If you really want to start on a specific floor, try to get hired as a tech or a CNA first. I would agree with that, because they already build that rapport with you in that specific area. Just finished my NCLEX predictor exam, got a 93 chance of passing, cutoff, passed the cutoff class. Okay, shout out to you, Natalie. Hey, you got a good chance then. They make us do an inspection before we go in, and they will send people home if they don't. Well, I'm glad they do that. I'm glad, because I'm telling you right now, first day I was in psych, first 10, 15 minutes, there was a code green. If you guys don't know what a code green is, just letting you know. It's a combative patient. Dude, it was a 15-year-old. Dude pretty much ripped the damn fire extinguisher off the wall behind the nurse's station. And because they said that he couldn't go out to the day room or whatever because he had assaulted another kid. When that shit happened, I was just like, what do I do? Do I punch him? Do I stand here? Will I get in trouble? Am I going to get kicked out of nursing school? And I was just like, the nurse was just like, hey, if he comes back here, that's a form of threat, so you can knock his ass out. And I'm like, so the whole time while I was in psych, I was ready to fight for my life. I'm not even gonna lie to you. I was ready to fight. So just be ready for that. Be ready for that. Came back and I had my first day today, and I'm tired. I bet. Hello, brother, new grad RN. I'm tired of bedside as an LVN. And interested in outpatient. Do I have a chance? Absolutely. Well, absolutely. You can actually look into remote jobs or online jobs as an LVN. I would recommend everybody, if you're looking for a remote job and if you don't want to do bedside, look at the Remote Nurse on Instagram. Go and follow that channel or follow that page. They post stuff every day, every single day. I heard MedSurg nice. It stinks a lot. Heard about that trick. Yep. Toothpaste is a good one in the mask too. Yep. Wow. Been in psych for 6 years. It's a love-hate relationship. Steph, you're a special breed with that one. For real, you're a special breed. What is that legit? I've got my ass beat and never hit back. Thought I'd get charged. I'm telling you right now, ain't nobody swinging on me. Sorry. Granted, you gotta protect yourself. The whole time I was there, one dude had a mental breakdown, and he was schizophrenic. This girl that was standing next to me, he flat out told her that she was racist, and she was like, "No, my husband is black," and he was like, "No, he's not." I'm like, "All right, we gotta go. We got to go. We got to go." So, hey, and this isn't me talking shit about people that are having these issues. It's about the simple fact that some people there are only certain people built to work in certain areas, and this guy don't want to work in psych. So and she definitely didn't want to work in psych. It's just part of what happened. So, um, how to study effectively in nursing school. Larry, I got you. Appreciate the follow. Simple nursing is great for studying. I agree, Shannon. It is pretty good for studying. It's good for nursing school. Did I send somebody an invite? I didn't mean to send nobody an invite. Oops. Typically dementia or CWA. Look, I've had some CWAs. Let me tell you, my man told me that there was a scorpion in the corner. My dumb ass thinking like, is there really? Because I live in San Antonio and we got scorpions here. So I'm looking and I'm just like, I don't see any scorpions. Another nurse come in like, what are you doing? I was like, he said there's scorpions in here. And he was just like, stupid. He was like, remember, he's in DT. I was just like, he's in DT. So I was just like, you right. You right. My bad. And then he started saying some shit like there's spiders on the wall. And I'm like, there's no spiders on the wall. Legit was a spider on the wall. So he wasn't hallucinating that time. I'm just saying. But Larry, to answer your question on how to study effectively in nursing school, this is probably the biggest thing that I tell people. Get into a study group. It needs to be yourself and 3 other people. Okay. So like if you're in fundamentals or if you're in med surg or whatever you are in, break up. So if you're going to have 4 people and you're going to break up, 16 chapters, each person does 4 chapters. And then after those 4 chapters, you do 25% of the work, but you reap 100% of the benefits because you have 3 other people doing the other 25% and they reap the same benefits. Put the notes together, go through them together. Boom. Now you have all the notes and all the important things that you need to know for when you go and you study. That's what I did when I was in school, and it worked out awesome for me. Hello, sir. I'm using Simple Nursing. Any advice? It's good. It's pretty good. Any tips for EKG or cardiac assessment? I start cardiac telemetry preceptorship tomorrow. The biggest thing that you need to realize when it comes to cardiac assessment is that you need to know your signs and symptoms of if somebody's complaining about X, Y, about if they're having difficulty breathing, if they start having chest pain, if their pain is radiating, their level of consciousness. You need to be paying very much attention to that. Second thing is knowing, because since you're going to be working in telemetry, you're going to know almost everything about EKGs, but you need to know the ones that are really going to stick out. Obviously, you need to know normal sinus rhythm. You need to know sinus tach, sinus brady. You need to know what the STEMIs look like. You need to know what VFib, VTach, AFib, A-flutter. You need to know what those look like. And then, you start learning about torsats, and then you need to know what the heart blocks look like. You need to know them all, right? So the biggest thing, what about ABGs? Yeah, you're going to know about ABGs as well. So your arterial blood gases, which is something that we know in school anyway, right? So arterial blood gas values, you need to know those. But when it comes to cardiac assessment, the very first thing is, hey, sir, your AVPU, as we call it, right? So if you're going to go in there, you're going to do your assessment. Remember, at that point, it's a focus assessment because they're there for heart reasons. Okay, I personally have never what's the word I'm looking for? I've never worked on a telemetry unit, so. But it's just like any other type of assessment. Joanna says, what is an NSTEMI? An NSTEMI stands for a non-ST elevated myocardial infarction. Somebody's favorite word was infarction. So there it is. Pretty much it involves, it's a partial block of one of the coronary arteries and reduces the flow of oxygen to the heart. And so you'll hear them say tombstones. Would you recommend going to LPN first or going straight to RN? Jordan, what I would recommend is it depends on how you are financially. So LPN schools, can be pretty pricey, but, RN schools can be pretty pricey as well. If you have the money and you have the funds to go to an RN school, do that. You can go straight RN. So like when people are just like, should I do this? I was like, here's the thing. If you can go RN, go RN. You have more, more responsibility and you have a larger scope of practice, but you could go be an RN and not like it. You could be an LPN and not like it. So it all just really depends on you and where you fall and what things look like for you financially. So, but I don't shit on LPNs. I love LPNs. I've worked with tons of LPNs that have been great. I work with LPNs that were not so great, but at the end of the day, it was just like, hey, what do I like? How can I help you type of deal? and they were great. And I've learned a lot. I learned wound care from when I worked in the burn center, I learned wound care from LVNs. I learned how to do wound care from them. And it was awesome. So I love my LVNs. But yeah, hopefully that answers your question. Mine was. Thanks for the answer. Okay, got you, Joanna. All right. Hey, so shout out to all 78 of y'all in here. Shout out to all 78 of y'all in here rocking with me. I want to know who you are, where you're from, where you're at in your nursing journey. You guys can keep smashing that like button. Somebody asked me why I quit the ICU. Well, I have a series. If you guys go look at it, I have a series of why I quit the ICU. And it's at 7. There's 7 of them right now. And I'm talking about specific things that I saw or that I experienced that really made me reconsider. And mostly it was because of the lack of training. I was an ICU nurse for a year before a year and 2 or 3 months. A year and 2 and 3 months, before I left the ICU. So all the stories that I'm telling y'all was about from when I started working in an ICU in January of 2001, and then I left or 2021, and then I left the ICU whole completely in March of 22. So, there's that. Some people are just like, oh, well, you're a new grad. I was like, well, I mean, I already had nursing experience, for a while in all IC and, a few ICUs. But, if you're not exposed to something, you're not exposed to something. Do you see them too much? What do you mean? What are you talking about? Future RT here. Love your content. I appreciate you being here. So, who is that? Shannon. Appreciate the follow. Thank you. Appreciate the follow. So yeah, we sit here and we were talking about the ICU and all that good stuff. But the way that the hospital that I worked at, that they trained nurses, it was pretty much a farce. It was pretty much like a lie. They were just like, yeah, you're going to get all this training. You're going to get all this time. You're going to get as much time as you needed. And then once you get off of orientation, like you're going to have a one-on-one person and you're going to have all these resources, yada, yada, yada. And before I got off orientation, I was like, look, I don't feel comfortable. And then the nurse educator, who was probably one of the biggest pieces of shit I've ever met in my entire life. She was just like, oh, well, like, you should be ready. And I was just like, well, I'm not. And then I got told by my manager at that point, she was like, well, it doesn't matter if you're on orientation for a year or for, however long, or for 3 months or 10 weeks or 12 weeks. She's like, you're not going to know everything. I didn't say I didn't know everything. That's the whole point. I'm trying to tell you, I need more exposure. And there was no continuity. So one day I'm doing one patient, and then another day I'm doing a completely fucking train wreck patient that I barely got any exposure to. And then I was doing a lot of COVID. I had a lot of COVID patients, so I knew a lot about event management. I knew a lot about, about the hemodynamics. So I learned a lot about that. But man, like when they exposed me to all the stuff that I was just like, hey, I've never had this. Hey, can you give me some advice? Can you help me? Can you point me in the right direction? And then it was just like, nah, man, like you just got to figure it out. Like who does that? So it's the culture. It was the culture of, hey, you got to figure this out, was in the umbrella of that nonsense. Nope. In my opinion, all ICU nurses or new grads or people going to the ICU need to do it. It used to be a 6-month orientation, and now they're just like, no, we can do it in 12 weeks to get you oriented, and then you can figure it out. 12 weeks with 9 different preceptors, make sense. You were ICU the whole time. I was ICU for a year, a little over a year, and that's for Emily. What state do you feel is the most challenging exam? All the exams are on a national level, and they're all the same. So it doesn't matter where you go. It doesn't matter where you go. Can we ask a non-educational question and just nursing? No, you can ask me a non-educational question. That's fine. Farah says, hey, what's up, Farah? NY studying for T's, trying to learn what's most favored department. As ADN, people seem to hate med-surg. Is it King Cozy? It all just depends. Some people love med-surg. Like, I know people that love med-surg. I thought you were Jason Derulo. How you know I'm not? Yeah, joke's on you. But it depends on where you want to go. I knew for a fact that I wanted to go ICU. Like you couldn't really tell me anything. But I mean, there's so many other departments there. You can go OR. You can go to labor and delivery. You can go to oncology. You can go to tele. there's the sky's are the limit. You can go to NICU, but most of the time NICU, they want you to, a lot of these places want you to have the basic nursing experience, and mainly is because they don't want to spend extensive time training you. That's why. So Jordan said, what could a new grad RN expect pay wise? That all just depends on where you live. Jordan. There's some like when I started my first nursing paycheck, I actually made a YouTube video about it. You can go over there in my YouTube and check it out. But my first nursing paycheck, I made like 25 an hour. And then after like 6 months, it went up to like 29. And now it's like in the 30s now. And I live in Texas. And that's like, that's like right around like the $50,000 a year or a little bit more a year type of deal. And then, of course, if you go to different positions or you go to different places, you'll get paid more. So it all just depends. But as a new grad, it really does depend. I think now they're paying new grads like $30 an hour. So do you have a bachelor's in nursing? Emily, yes, I do. A quick question. What's your opinion, ED, ICU, or OR as a new grad with post-acute / med-surg experience? Fair, it all depends on you and where you want to go. The ED is wild. Like, controlled chaos. ICU can be wild too with controlled chaos. It honestly all just depends on where you go. All of them have their pros and cons. ED, it's very fast paced. ICU, you learn a lot about maintenance and maintaining the patient. And OR, you learn all about, the surgical sterility aspect of working, on a patient in a surgical environment. It all just depends on you and where you want to go and what you want to experience. I have worked in all three. In the emergency department, I was an EMT at that point, but I'm not going to go back there as a nurse. But I've worked in ICU and I worked OR as a nurse. And so I could tell you that it all just depends on what you want for yourself. ICU, you can get, 2 critical patients, depending on where you are, you'll get 3, maybe 4 if they want to really try to screw you over. OR, only one patient. So Genesis said, paid $15K for my LPN program after 4 years, making $75K a year. Now I have the money for RN school. Shout out to you, Genesis. I got IV regling yesterday and lost my shit. How long until I feel normal again? Well, I mean, it shouldn't take longer than 24 hours. However, if you're not feeling well like that, Mackenzie, you need to go back to the doctor. Do you think an RN degree is a long-term career, or do most people get sick of it after 5 years? I don't know if anybody's ever read or seen that. There's a documentary called The One Child Policy. Long story short about that, they were in China, they could only have, like one kid, and they started getting, killing kids and stuff like that. So in China, they have a generational gap, like old people, no middle people, and then all these young people, right? So in nursing, that is what nursing is suffering from right now, is a generational gap. When COVID happened, or right around COVID, when it happened, all of the nurses with the experience left. They left the hospitals, they left to go travel, or they just quit nursing altogether because of how they were treated, the lack of the regulations, you name it. That's what we're having. And so right now, on average, people are at hospitals for like a year. It used to be a year and a half to 3 years that people will be at hospitals before they decided to leave. Right now, the turnover rate in hospitals can't keep nurses on staff. They can't. That's why that's why they always have a shortage. That's why they always have it. So we have, like I said, we have what I call a generational gap in nursing. We do. We have the younger nurses that are, just coming out of school, 2, 3, 4, 5 years, like myself, because I'm at 3.5 years. And then you have, the ones that are on the verge of retiring, or the ones that are like at 15, 20 years that are just like either barely working bedside, or they're out in a clinic somewhere, So, and I can tell you right now, I have not met one nurse right now that's working bedside that is just like, oh my God, I love it here. Like they get tired of being overworked and underpaid. And it's kind of how it is. Thoughts on long-term care nursing. Long-term care facilities, be aware that those people live there and be nice to them. The second thing is, I've never worked there in a long-term care facility, but if that's where you need to go to pay your bills and do what you need to do that for yourself. Ferris says ED, then ICU, second option. Okay, shout out to you. Damn, that's crazy. I feel like there's many going for aesthetic, and that is so aesthetics is aesthetic. Emily, aesthetics is not at bedside. That's not at bedside. So when I say people are leaving like the nursing realm, they're leaving it. Like they're leaving the bedside at the hospital. That's where they're leaving. And I kid you not, there were 3 girls that I worked with. 2 in ICU, and then 1 when I worked in the OR. Every single one of them. One girl, she got a year or 2 of ICU experience, and she was like, I'm going to go work aesthetics. I got a job. Another girl was like, I'm just waiting for me to hit my year mark. No bullshit. A year, and then a day later, when she hit her year mark, she put in her 2 weeks notice because she had already had a job lined up. And then the next day, she had started working there, and then she was done. So that's where people are going. Go to where you want. And there's so many jobs out here that they want RNs. They want them. COVID definitely made me question pursuing my career further as an aide in tech. It'll do that to you because 40 patients and 40 patients and you get paid the least there. It's wow. How are pharmacists perceived, utilized, valued within the hospital from a nursing standpoint? All the pharmacists that I came across they were great. My first interaction with the pharmacist, though, it wasn't such a great one. This was like right when I was brand new. Like I was like right off orientation, and I forgot to pull a Venk trough, and so the pharmacist was monitoring the Venk trough, and I was because like during the day shift, like you got to do everything, and so I was just like, all right, cool, I forgot the Venk trough, my bad, and she was just like, okay, well we can't forget that. She kind of got mad at me, and then after that we were cool because I started asking her all these questions about, hey, what does she need? What do I need to do? Like I'm going to ask you because there's so much that you have to remember based off of, the acuity that's going on with your patients. Thoughts of corrections nursing? Go. They make money. They make pretty good money. Kelly says, I love my job. Been at bedside and will retire from it. The VA is the best. There's the difference. You just said that you work at the VA. That is a totally different story because VA hospitals, military hospitals have help. VA hospitals and military hospitals have help. I used to work at when I first started working as a nurse, I worked at the burn center at Brooke Army Medical Center here in San Antonio. So they have help, tons of it. Palliative and hospice RN. Are you asking about it? Oh, that's where you do. Oh, okay, I got you. You take your NCLEX tomorrow? Well, Z, I'm gonna need for you to go and relax because you shouldn't be here. I mean, we're not doing questions anymore, but now you just need to go and relax. And I know that's, easier said than done because, you're nervous about your exam, but you're gonna rock that exam. Don't you even put it this way. If you've been studying properly, like you should have been doing for the last, month, 2 months, 3 months, or however long, you're going to rock that exam because I'm going to tell you what an instructor told me. If you don't know it by now, you don't know it at all. Right. And the thing about, when you're studying for NCLEX, it's not about memorization. It's about being familiar. There are certain things that you have to memorize, but you need to be familiar about what is being put in front of you. OK, but, I'll put all that energy out in the universe for you. I know that you and everybody else is going to be taking their exam tomorrow or the next couple of days. You guys are going to rock it. So that OT is nice, but sad. We had to work OT to get adequate pay. Look, I'm put it this way. I don't work overtime. And I do PTO. Overtime is not me. And PTO, you better prepare the others because that's what it stands for. Thoughts on MP route and opening up a solo practice? Do it. You're welcome, Z. Do it. Open up your own practice. Making more than an MP. Yeah, they are making more than MPs. But hey, if that's your passion of being a nurse practitioner, do it. My son's provider is a nurse practitioner. She has her own practice. She's a pediatric nurse practitioner. She has her own practice and she loves every bit of it. Have you worked on sonography or radiology tech? Are they generally okay with their job? Most of them love their job. They're on call a lot. Those X-ray techs they are. So, but most of them, they like their job. Most of them. How do you recommend studying in your 7-day NCLEX course? So the biggest thing, so like I said, more content is being put up in there. But the biggest thing right now is studying content. So study content. And so the best way to do it is to study content, like, for like a good 2 hours, 3 hours, whatever. And then after you do that, whatever test bank that you have, start doing a quiz, 85 to 150 questions. And then after you do that, you need to remediate. That's how you do that. That's how I recommend studying it. And other videos are going to be put up. explaining that as it goes down. So if anybody has the program, that's how it's going. That's why I'm saying, hey, it's in the pre-launch. That's why it is the price that it is. So, and it's going to sit there. It's going to sit there for a while. Once the review is up, then, things are going to change. So, how you worked with have you worked with radiologists? I might want to do that. I've never personally worked with a radiologist. However, you can become a radiology nurse. Like, you could be a nurse working in radiology. Did somebody just give me something? You gave me a crown. Appreciate you, Farrah. I appreciate that. You helped me hit that goal by giving me that crown. So I appreciate you. It says, my ex-girlfriend is a rad tech and she loves her job. I have never really heard a rad tech complain. I really haven't. Like, all right, some people aren't going to like me, but there's a strike that's going on in California and it starts on the 4th. They're paying x-ray techs like $108 an hour. $108 an hour. I'm just saying. Metal, appreciate the follow. Thank you. I'm just saying. The opportunities are out there for you to make this money. Other people aren't going to like it. They're going to call you scabs if you decide to want to do a strike. Whatever, to each their own. They're not paying your bills. Vet med here, even our x-ray techs don't complain. That's what I'm saying. Like, x-ray, like, I even said that. Somebody asked me if I couldn't have been a nurse, what would I have done? And I said, I would have done x-ray. I would have been an x-ray tech, and then I would have gotten certified, in ultrasounds as well as MRI and CT. That's what you want. That's what you want. That's where you want to be. Radiology nurse. Can you explain more? So essentially, you can be a nurse working in radiology, doing the same things that the techs do, but you get paid as a nurse. If you go to nurse.org and if you go to resources and if you look at certification, you can actually Google what a radiology nurse is, what it does. They actually have a certification for it. So you can be a certified radiological nurse. Yep, getting my specialty in medical imaging for that reason. Look, that's what I'm saying. Because I met some x-ray techs a long time ago. They were both husband and wife. And he was just like, yeah, both me and my wife are about to get certified in CT and MRI. And I'm just like, okay. As an MRI tech, they make well over six figures, like $120 an hour, depending on where you work. So between the two of them, they're both pulling over 200K. So hopefully that answers your question. And yeah, but I appreciate all 50, 49 of y'all in here rocking with me. I appreciate everybody that decided that they wanted to come to the NCLEX questions that we do, 3 times a week here. I think everybody wants me to do them every day, but if I do that, I'll run out of questions. So, but yeah, so shout out to everybody that is here. What other questions do you guys have? Whatever question do you guys have before I get off? Because there's food, you know what I'm saying? And your boy is hungry. My sister is a radiology nurse. That's what I'm talking about. Hey, DJ, you should tell your sister to come over here to the live one day. Casey, I appreciate the follow. You should tell your sister to come over here to the live and explain what a radiology nurse is. I'm just saying. Fab Life, appreciate the share. Love, appreciate the follow. Oh no, I'm late. Have fun eating. Yeah, you late. However, you know what I'm going to do. I'm going to put this up on YouTube. So it's for that reason. If you miss it, that's where it's going. Yeah, it's like a chicken sandwich, I think. I'm about to go destroy that. All right. What other questions do you guys have? She does a lot of kidney biopsies and cardiographs. But when I finished nursing school, I prefer ER. Shout out to you. Hey, we all have our calling, right? We all have our calling. Yours is ER, hers is radiology. For me, like, I thought it was ICU. I'm sorry. I thought it was CRNA, which ICU I needed to get there, but that ain't it. That ain't it for me. Mine is education. So I'm going back to school to get my master's in education. And then eventually, depending on how I feel, and if I want to go back to school, then I'll get my DNP, or I'll get my doctorate, or I'll get my PhD in nursing education, or education altogether. So we'll see how that goes. But all right, cool. Well, I think we're good on the questions for today. Enjoy your meal. Hopefully I catch the next one. I'm curious about the vet med and the him. Okay. All right, cool. No worries. All right. Well, I appreciate everybody that came by. OMG. I love teach. That's what I'm saying. That's what I'm saying. I was a search tech instructor for 3.5 years, and I taught a lot of things while I was active duty in the Navy, and I'm a master instructor in the Navy too. So, like I said, I love teaching. Teaching has been like the thing I've loved for like the past almost 9 years. So, licensed vet tech, so nurse for animals. Oh no, I got you. I'm tracking. I'm picking up what you're putting down. So, but yeah, I appreciate all the questions. I appreciate everybody rocking with me. We are going to be here 5:30 on Wednesday, going over some more questions. I might find me a different batch of questions that are not on nurselabs.com. I may just make up my own. So we may just see how that goes. But be great to yourself. Be kind to yourself. There's only one you. And if you can't take care of you, you can't take care of nobody else. I don't give a fuck who they are. I don't care if you're your husband, your wife, them badass kids you got, because I got some, you know what I'm saying? So always take care of you. But until then, I will see you guys on Wednesday. Bye.